Hi, everybody. This is Dr. Bailey. Wanted to welcome everybody to Health Psychology. Thought I'd start off with a few points about Chapter 1. And one of them is that we have what I call medical technophilia. That's just my term, by the way. I don't know if it exists in the popular health psychology literature, but I feel like people believe that we are living longer, mostly due to medical technology. I saw some of the comments in the Chapter 1 discussion board where people were basically saying, oh, it's medical breakthroughs. That's why we're living longer. But that wasn't the point of Chapter 1. And I hope people realize that most of the advances in longevity have to do with behaviors, things like washing our hands, taking care of children a lot better than we did 100 years ago. In fact, there's been more and more technological advances, but we're not living much longer. In the last 50 years, there's been almost no increase, very little increase. Most of the increases in longevity occurred right at the beginning, 1900 to 1940. I'm not suggesting medical technology isn't important. It's huge. And, penicillin being invented in 1940, that was gigantic. There's no question about it. But if you think about it, most medical technologies help keep us sick longer, but not necessarily healthy. And most of our health comes from our behavior. So that's sort of the point of this class. That, and of course, the power of mind, power of the mindset that we have, as we'll get into chapter 2, the placebo effect. I don't mean to overplay it, right? But sort of the point of this class is that there's the psychology affecting health much more than health affects psychology, or at least that's the perspective we're going to be taking. So one of the biggest examples of that, of course, is COVID-19. I hope everybody can see that it was a psychological phenomenon that led to most of the deaths. Maybe the first 100,000 they predict in the United States were caused by the actual transmission, before we could get our head around what was happening and what to do about it. But most of the 900,000 people who have died since, it was more to do with attitudes and behaviors, our beliefs about what we should do about this disease, than the actual vaccines or treatments that are available. The good news is the vaccines are very effective, and the treatments now really extend the possibility that if you did get COVID-19, that you'd survive it. But I hope everybody realizes that this is such a health psychology phenomenon. It was kind of exciting to be teaching at this time and horrible at the same time, because everything I've been teaching about in previous years really came true. Sadly, the lack of scientific and statistical understanding continues still to this day. I literally just read a Washington Post article that doesn't understand statistics. So I thought I would bring you through that. The rest of this video is a little wonky, a little bit statistical heavy, but I think it's something that maybe if you learned, you could take to other people who kind of maybe react too quickly to a headline. So here's an example headline. Half of all hospitalized patients with COVID were vaccinated. And again, if I read that headline, I didn't know much about statistics, or maybe I just wasn't paying attention. I would look at that and go, well, then why bother getting vaccinated? If I'm just as likely to end up hospitalized if I was vaccinated or if I wasn't, right? That headline makes it sound like vaccines are pointless. So I'm going to break this down a little bit with statistics. I apologize, but hopefully you can follow along. And again, you could rewatch this if you can try to gather it. But let's get away from COVID and just say virus X, right? I'm just sort of pretending here. But if the headline was half of the people in the hospital for virus X have been vaccinated, and these other three things were true, and again, this is sort of based on COVID, these statistics are about right. Let's say 90% of the population is vaccinated, 50% more likely to get the virus if you're unvaccinated, and then 600% more likely to be hospitalized if you're unvaccinated. These could all be true. It could still be true that half of the people in the hospital have been vaccinated, and all these are also true. So let's see how that could be. First, let's start by saying, well, what if only 50% of the population were vaccinated? So literally half of the population was vaccinated. It's a little easier to start there. Out of 1 million people, again, we'll just say there's a population of 1 million and half of them are vaccinated. So we've got literally 500,000 in each category. They're just for the sake of, half of the people in this population are exposed to virus X, and you're a little less likely to actually test positive. So the vaccine helped a little bit. And again, this is about right for COVID, is you're less likely, not by a huge amount, this is actually a 50% reduction in your likelihood of getting the virus. So that leaves us with slightly different numbers. And then you're 600 times more likely to get hospitalized if you were to test positive. So that's where this number comes from. So again, if 50% of people are vaccinated, start with equal numbers, and by the end, who's hospitalized? You're 9 times more likely to be in the hospital from virus X. And notice that the total people in hospital are 12,000 out of a million, so it's about 1.2%. Now let's move it to 90% vaccinated. Let's say more people are vaccinated. What does that mean? We end up with a lot more of the population is vaccinated. Hopefully some people are already starting to see why you might end up with half the people in a hospital vaccinated, right? So we end up with 450,000 that were exposed compared to only 50,000. Again, we got the same statistic as before, that 24% test positive versus 36, or 50% less likely to get the virus. But again, this is still such a big number. Why? Because this is such a huge number. We only have 10% of the population that are unvaccinated. You end up with a smaller number here. 2% versus 12% of those people are hospitalized, and guess what? You end up with the same number of people. Notice here, only 4,000 people are hospitalized out of the million. So getting a bunch more people vaccinated saved almost 8,000 people from getting in the hospital. However, if all you did was look at this number and say, oh my gosh, it's the same as this number, your headline could be half of the people in the hospital have been vaccinated. And some people mistakenly think that means the vaccine is not worth getting. So again, look over these statistics again. Maybe I went too fast. I don't know. I've had students really struggle with this. But my main point is that when you start with a really large number, you end up with a bigger number than you had before. But again, we saved a lot of people from being hospitalized by getting them vaccinated. We moved them over from here over to the vaccinated group, and statistics all stayed the same, right? They're 600 times more likely to get hospitalized out of whatever number you're talking about. So you can see that I do some extra credit. There's something hidden in the syllabus, and there was something hidden in my welcome video. So here's my bonus for people who are still following along in this video. I'm going to have an optional discussion on COVID, and if you can kind of explain what the heck I was trying to do in this video in your post, you'll get a bonus on that first exam. So good luck, everybody, and I look forward to reading you soon.